Hi Greg, my name is Brady Petermar. I'm in the PTA program at Kirkwood Community College. Is it okay if I work with you today?
Yes.
So how are you doing?
I'm doing pretty good.
Okay, so how's your right leg doing?
I think it's getting better.
Okay. Has there been any changes since the last time I saw you?
It's hard to say.
Okay. So are you having any pain today?
Probably about
So,
2.
On a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain you've ever experienced, where would you put your pain at just laying here?
A 2.
Okay, and then how about when you were up and walking around with the nurses today? So up and active, where would you put your pain?
Probably a 5.
5? Okay. So I did see that you've been walking around with a walker. How's that been going?
It's going. I think I'm getting better at it.
Okay. And you also had some arthritis going on before that. Is that getting worse when you're up and walking?
No, I just feel it more.
Okay. Alright, so what we're going to be doing today is we're going to be using something called electrical stimulation. So I have these 4 electrodes we're going to place on your leg, and we're going to be sending a signal through the electrodes, through this machine into the electrodes, and it's going to help contract your muscle. And so I'm going to position your leg to where it's bent at 90 degrees, and when the contraction happens, you're going to assist the machine, or it's going to contract your leg, and you're going to help it and extend your leg for 10 seconds, and then for 40 seconds you're going to rest, and then before the next 10-second interval, and we're going to do that for 20 minutes. So the reason I want to do that is because you have this loop between your brain and your leg that sends a signal to contract, and right now that loop needs to be reestablished. So that's why it's hard for you to contract your muscle. And so you have the strength here, it's just the signal is not being sent down properly to move the muscle.
Okay.
Alright, so is it okay if I look at your leg?
Sure.
Okay, is it okay if I touch?
Yeah.
Alright, everything's looking good. So I'm going to place these 4 electrodes on your leg. Then I'm going to get my machine going. And before we get too carried away, I'm going to get your leg positioned. Basically, I'm going to have your knee positioned at a 90-degree angle. So we're going to go ahead and lift your leg up. Okay, we're going to keep it a little bit like that. We've got a couple extra blankets so we can... We'll get one more in there. Okay, so then when you feel the intensity, it's going to contract your leg, which is going to extend your knee. So what you're going to be doing is holding your leg up like that for 10 seconds. And then when you stop feeling it, your leg's going to relax, and you're going to relax for 40 seconds, okay?
Okay.
Alright. So when I get this machine going, I'm going to start with no intensity at all, so you're not going to feel anything. And then as I turn it up, I want you to tell me when you feel like a slight tingle. It's not going to hurt at all. And then once we do that, we're going to progress a little bit further, and the overall sensation is going to be uncomfortable, but it's tolerable. So if you feel uncomfortable and you can't tolerate it anymore, you just let me know, okay?
Okay.
So I'm going to start turning it up. Tell me when you feel a tingle.
Okay, I can feel a little something.
Okay. Then we're going to keep going. We'll get a little more intense. Okay, and then right when I hit this spot, you should contract. Okay, alright, we're going to stop it. So that's the intensity we're going to use, and we're going to go ahead and start our 20-minute treatment, and it's going to start with the first 10 seconds of contraction, and then 40 seconds rest for 20 minutes, okay? You ready? So I'm going to push start, you're going to contract for 10 seconds, we can just call that 10, come back down, 40 seconds will go by, and so for 20 minutes you're just going to be going 10 seconds up, 40 seconds rest, and if I had other stuff to do, I would leave a bell, timer, show him how to turn off. But for this specific patient, I'm going to stay with him for the 20 minutes. And then to conclude the treatment, I'm going to turn off the intensity, unplug it, take off my electrodes. And while I'm here, I'm just going to quickly assess the skin real quick. Is it okay if I touch?
Mm-hmm.
Okay. Looking pretty good. So, how do you think that went?
Went good.
Okay, good. Are you having any pain at all?
Just what I had before.
So the same 2 and 5?
Yep.
Okay. Well, I guess that's all I have for you today. Do you have any questions for me?
No, not really.
Okay. Do you have your next appointment scheduled?
I don't think so yet.
Okay. We'll get on to that, and I'll see you next time. Thanks, Greg.
All right.